Not long after the presidential inauguration just weeks ago, my coworkers began having odd encounters with Google over its online advertising. The tech megagiant rather suddenly started rejecting our attempts to place advertising on its search engine about topics such as human reproduction, in vitro fertilization, and infectious diseases. These are the kinds of ads that we've placed and managed for more than a decade as a quite minor part of our work to promote public health information. They link to physician-reviewed information we publish on our medical practices websites about topics ranging from achieving a healthy pregnancy to overcoming infertility to research into an HIV vaccine. This is information that the scientific and medical communities resoundingly view as vital to maintaining good health and even saving lives. Curiously, the same information is readily available through Google searches on federal government websites and those websites of revered healthcare legends such as the Mayo Clinic. But while Google helps you find the info through what's called organic internet search, it doesn't want ads leading you there, even though it would make money to do so. In a call with our assigned service representative, we learned that Google would allow us to continue IVF, pregnancy, and reproductive-related ads under existing Google accounts, but no new accounts or new campaigns would be permitted. When we asked why, the answer was simply, it's the company's policy on birth control. Birth control, you heard that right. You'd think the brilliant minds at Google could distinguish between birth control and birth creation. The best detail I could find on Google's advertising policy was on its webpage, explaining its so-called sensitive interest guidelines. The page states, and I quote, "We don't allow personalized advertising on such personal hardships, including health conditions, treatments, procedures, personal failings, struggles, or traumatic personal experiences." The policy itself isn't new. For the last year or two, Google sometimes, without warning, suspended the ads we manage. However, prior to 2025, we were able to get them restarted by appealing to Google. Not this year. That's not all. Suddenly, again without notice, warning, or explanation, since the beginning of January, whenever we use what's called the Google Keyword Planner to research popularity of 70-plus search terms, such as intrauterine insemination, endometriosis, and polycystic ovary syndrome, the online tool returns the message above a nearly blank screen, quote, "All keywords were removed," end quote. In other words, move along, folks. Nothing to see here. In fairness, Google policy says it doesn't want to exploit people's personal struggles. In this vein, young women are complaining bitterly about relentless ads on social media for egg freezing and fertility testing. No doubt about it, diminishing fertility can be an extraordinarily emotionally taxing problem for women, generally more so than for men. Yet while about half the population is born female, others are born with higher biological risks of morbid obesity, rheumatoid arthritis, and chronic depression. Should we then prohibit the oceans of advertisements for Ozempic, RA medications, and antidepressants flooding television? Instead, can't the more sensitive among us just limit their TV and social media time? At the same time, let's acknowledge bad actors among advertisers, some of whom have reportedly gotten undeserved passes. A 2024 report co-authored by the Center for Countering Digital Hate and MSI Reproductive Choices found that both Google and Meta, the owner of Facebook and Instagram, have restricted access to reproductive health information in Africa, Asia, and Latin America. The report further alleged that the tech behemoths simultaneously failed to address anti-abortion misinformation and abuse directed at local reproductive health partners. Accordingly, congressional Democrats have urged the Federal Trade Commission to investigate a 2022 report that Meta turned down ads from dozens of women reproductive health groups advocating a sexual health program for women while allowing those for men. Of course, finding itself in the news media spotlight, Meta updated its rules to include more examples of permissible ads, such as for family planning and pain relief during sex. So, where does President Trump fit into all of this? It's possible that the time of Google's ad censorship was entirely coincidental with the appearances of Meta chief Mark Zuckerberg and Google CEO Sundar Pichai at the presidential inauguration January 20th, along with ex-owner Elon Musk and Amazon chief Jeff Bezos. And maybe it's sheer coincidence, too, that a week later, Meta agreed to pay $25 million to settle a Trump lawsuit for suspension of his Facebook account following the January 2021 insurrection at the U.S. Capitol. And that the Bezos-owned Washington Post announced less than 2 weeks before the election that it would not endorse a presidential candidate for the first time in 40 years, most likely to President Trump's advantage. And that Bezos' company, the world's largest bookseller and now a major TV streaming service, is paying $40 million to license an Amazon Prime documentary on First Lady Melania Trump. Call me a crazed conspiracy theorist if you like, but there are a growing number of dots to connect here. Google has more than 80% of market share of internet search. Elon Musk's X platform has 540 million monthly users. Meta, TikTok, and Google-owned YouTube collectively claim 9 billion monthly users worldwide, more users than there are humans on the earth. 2 weeks before the election, Meta announced plans to end its fact-checking program. Musk jettisoned the guardrails on X against misinformation and disinformation in October 2023. The same month, he directed 150 million followers to 2 X accounts notorious for promoting egregious lies, including one posting anti-Semitic attacks. These men, yes, they are all men, control a vast chunk of global information, and they are cozying up to a politician who has reduced access to birth control, bragged about ending constitutionally protected abortion rights, suggested bleach injections as a possible treatment for COVID-19, issued executive orders reviving some anti-abortion policies, nominated the nation's most famous anti-vaxxer as the chief health officer, and reversed the Biden administration's cost reductions on prescription drugs, plus weakened protections for Medicaid and royalties. There's not one scientifically or medically trained professional among these men. Are they the world's rightful arbiters of what makes good science and life-enhancing and life-saving information? Or are humans worldwide veering towards the most unimaginable Orwellian health catastrophe?